Hello, everyone, and welcome back to Local Liberty. This is Brian and Shane. We are continuing the College Chat series, where we are discussing questions from Shane's American Government course at QVCC. The question of the day is Is the American healthcare system broken, and what should be done to fix it? It's a good question. As we've talked about previously on many segments of this show, we've laid out certain things that are what I would call the levers of control over a society. Things like roads is an obvious one, transportation. Healthcare is a very important one. The reason why it's important because, to put it simply, people value being healthy in one way or another. And when they're sick, people want to get better. So you take control of something that is very valuable to people, and then you will have a large measure of control over them. So to me, that sets the stage for what this entire conversation going back 100 years has been about, is about wrestling control over something that people want. And the point I would like to make to open this up for conversation with Shane is going back, talking about healthcare as not as a system, but as a political topic or something of interest to government. That goes back a long time. That goes back around almost 100 years to things like the founding of the American Medical Association, and then certain laws that grant some very powerful privileges to organizations like the AMA. And
it goes back even further than that.
It does. Let me just finish this point. Where I see all this is people like to. This debate is often keyed up in frames like, look what the free market gave you. The free market gave you $50,000 MRIs. But look what a single-payer healthcare system can give you X. So what they do is they set up this false argument of saying that the system we had 5 years ago or 10 years ago was free market healthcare, when it was anything but that. The free market has not existed in healthcare for a very, very long time. So that's where that's kind of my starting frame of reference for this conversation is when we say, can we do something better by government action, the better that we're comparing it to is previous government action. So Shane, what are your thoughts on the subject?
Well, I was going to compare it to previous government action. I was going to compare it to the various other outcomes around the world. And I got I went to three different sites. One, Bloomberg.com for most efficient healthcare system. So in this, it also took into economic repercussions, percentage of household income that is part of healthcare, and other factors in addition to actual health outcomes. Then the World Health Organization's top countries. This seemed to be solely focused on health outcomes. And then something else just separate from the healthcare system, healthiest populations in the world. And in none of these is America highly ranked. For the most efficient, of the 51 countries Bloomberg cited, apparently because ones they could get actual good data on, America was 44 out of 51. Some of the top countries in that study were Singapore, Hong Kong, and Japan. Interesting. I found that interesting. The Nordic countries, which are often talked about as paragons of healthcare, indeed we'll talk about them later, they're in the top 20, but it's these Eastern Asian countries that are doing that in terms of efficiency. And then the World Health Organization has France as the number one healthcare system in the world, and this would probably be, you talk about, is the most socialized healthcare system. And then the last when I talked about healthiest populations, which I didn't write down where I got this from, now the Nordic countries are back up top, and so is Japan. So, but in all those, the United States is not even in the top 35. It's always way down there. So clearly we're doing something wrong. There's other places around the world that have healthier populations, healthier societies in general. Why is that the case? But there's a problem, and that's where I wanted to start from. That there's something happening, and there are things we can refer to that other areas we can refer to around the world that are doing better.
Right. So that analysis, I think, actually leads directly into the point I was trying to make. Is you start off with saying, okay, there is a problem. Something's not working out right.
Right.
And then in a sort of a mathematical or an engineering kind of mind, people want to know, where are we now? Because like when I'm talking about, in the IT world, or I got some project on my plate, or I have to transform something, I need to know present state and future state, and say, okay, we're here right now, and we want to transform to over here. And that's where people fall into the trap of saying, well, our present state is we're letting willy-nilly all these greedy corporations run everything, and it's the free market that's got us where we are now. And then we'll say, okay, well, if the free market's got us where we are now, then we need to try something different. And that's how this conversation gets steered towards the direction of, which I think is the wrong direction of, we basically try to pour more fuel on the fire, and that we've been intervening in the healthcare system in this country. And I'm comparing to other countries is a worthwhile endeavor, but I'm more focused on what has happened here and what is happening, what will happen. We've been intervening in the healthcare system in this country for a very long time. That, and I think a myriad of other inputs, has produced some bad results. One of them is some crazy things like this food pyramid, where getting people to eat 25 bowls of cereal a day has created a very unhealthy population. And now, what are we going to do from there? Well, we'll say we're going to double down on intervention, and then we're going to expect better results. I say when you analyze this from the state of understanding our true present state, that just sounds absurd. And we're basically gonna the bad medicine that has not worked out. Like, I'm always using medical analogies. It's just a good time to use a medical analogy. We've been treating the symptoms with X. Now we're going to treat the symptoms with 3 times X, and now the symptoms should get better. Even though X didn't work, let's just triple X, and then everything will be better. Oh boy.
Don't worry about that. Keep going, Brian.
That was it. That was a good finish for me. I'd blowing up the set. So basically, okay, so to summarize, we are we have had a boatload of intervention in the healthcare system for a very long time. To answer this specific question, you guys probably could have guessed this words were going to come out of my mouth. We want to fix this problem. Get the state, get the regulation, get the aggressive force applied to how people make their individual decisions, get that out of the mix, and let the systems, let voluntary interaction solve problems like it has in a lot of other places.
What do you think, though, if I grab my list again, about the fact that there's other countries around the world that have sometimes dramatically better health outcomes, and they have the state's intervention? Because you're talking, because you say...
I don't think there's I have a different perspective of cause and effect there, basically.
Well, here's what I can sense other viewers might be thinking when you say this. You say, we can't keep doing what we're doing, blah, 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 blah. But there's other places around the world that are doing things differently. And believe me, all these countries are doing things very differently than us. Why don't we look to some of their models?
Okay, so to use an example... And we're starting with our measuring stick is we have in America we have a population that's super unhealthy, like obesity rates, cancer, whatever. We just have an unhealthy population. That's our outcome. And then we go to a place like France and we say, okay, well, let's see, people are much healthier. And then we say, okay, what are our similarities? Well. Or the differences, I should say. We'll focus on the differences. Differences in input to account for the differences in outcome. And you could get hung up on the fact that in France they have a fully socialized, universal, single payer, whatever the hell you want to call it, a fully socialized healthcare system. And you could, if you really didn't want to dive into the issue in any depth, you could just leave it at that and say, well, socialized healthcare, that's the way to go.
By the way, I don't know if France's healthcare system is truly fully socialized. Okay, because all these single-payer systems, it's still private companies providing healthcare. The government just pays for it. So that's different than the government actually running the healthcare system with socialism. Right. Okay, but it's not centralized control.
I don't know the detail there myself.
So France, I don't know.
But it's fair to say that on whatever form it takes, France's healthcare system is far more socialized than the United States is or was. Now, what I was getting at is you could end the conversation there and you could walk away with your simple conclusion. However, you're completely ignoring, and this is talking about real economic analysis, is one, you have to think of the seen versus the unseen factors. And thinking about tying it back to like our homesteading series, I remember reading books about gardeners that would travel the world to find new new things to grow or new techniques to grow. And this one author spent a lot of time in France. And what did he observe about the French people? They ate tons and tons of fresh fruit and vegetables. Maybe something like diet has a massive contributing factor to the outcome of the health of the population. People in France like to eat lots of fresh fruit and vegetables. People in the US of A like to eat bread and steak. And I love bread and steak, but I know for a fact that I'm getting more nutrition from the stuff I grow in my greenhouse and the stuff I grow in my garden. So my point with all this is you can't draw the conclusions on the surface from just saying the population of France is healthier and since France has a healthcare system that looks like X, you can say, well, the United States should also have a healthcare system that looks like X, and that will solve all our problems. You make so many assumptions of cause and effect that your assumptions could potentially be totally wrong.
Well, the problem with your example right there, though, is not what people would actually do if you're doing a rigorous scientific analysis or understanding the data. You're not going to just look at France.
But
That'd
the
be stupid.
But the political debate.
You're going to look at all the countries in the world that are doing better than us.
But now, a rigorous scientific analysis and a political debate are not the same thing. A political debate would oftentimes play out in just the depth that I had described.
I agree. You're completely correct. But the goal is right now the outcome, healthier populations. So first you have to look at what countries in the world have the healthier populations, and then you work your way back. What do they all have in common? Maybe what things do they don't have in common? And if you can see a common thread among, say, 40 out of 43 countries, that they all have X, and they all have this, and they all have that, you can start drawing conclusions based on that and moving in those directions. The ones that have the most evidence for that is what I'm saying. Right? Your example of just pointing to France is just one example. I mean, that's just one country.
That was just
right?
the one that
that would be like you said, would be the superficial analysis. That's really foolish. Like Bernie Sanders, he talks about Denmark a lot. He really loves Denmark, it seems.
And I've seen some funny memes about people from Denmark saying, "Please stop talking about us, Bernie Sanders."
Yeah, because he's wrong with some of the things he says about Denmark. But anyways, ignoring that, his obsession with one country is really problematic. Okay, that's one other country in the world, one small little country. Maybe you want to broaden your viewpoint here. That's a really bad way of looking at things. It worked well for that person, so it must work well for me. That's just stupid. It doesn't make any sense, right? So that's the kind of superficial analysis you see. You point to one thing, one data point. That's it. There's the answer. That's not how it works. You have to have many data points. You have to look at that. It's a lot more challenging to actually understand the issue than just to pick. Denmark's awesome. Let's just do everything like Denmark.
Yep, and that's the real challenge of honest economic analysis. Is even when you're talking about data points, the data points by and large come down to what you can see, and a real analysis of a government, a particular political action, is you need to think about what's unseen. You need to think about what choices were not made or what choices were taken away. When, let's say you vote for, in this country, we're going to vote for the rollout of Obamacare, and it's, for better or for worse, it's making lots of changes to things, and it's impacting businesses. It's changing hiring practices. I think it's a big contributing factor towards consolidation, and where companies, only the big companies can by and large deal with this level of bureaucracy, and also a lot of the big companies are not even affected by it, but that's another story. You have to think about the seen and the unseen of, okay, I'm going to, I did my scientific analysis, and 43 out of 50 countries that are healthier than the United States all had a much more heavily socialized healthcare system. Therefore, that's the way we're going to go. That's the technocrats that marry themselves to the government. They've made a decision in the name of good science. Well, okay, fine. We're going to up everybody's taxes by 10, 15% to pay for it. What's not happening now with the with the billions or trillions of dollars that people are not going to be able to make their own decisions with now? What didn't happen from that? What cure for cancer was not found? of course, you can't answer these questions. I'm not saying that these are answerable
Right,
questions.
see,
but these
that-
are questions that you can't ignore.
Yeah, but you're right. You want to make those unseen things that are seen and that you can plot, that you can actually measure, so that you can add them to your analysis. You don't want all these variables that you don't know that you don't even know about. You want to know as much as possible. So you have to be very specific about, first of all, what you're looking for. Like, you keep saying socialized healthcare systems. But even that word, right, socialism, socialize, like Bernie Sanders, the way he uses that term is different than it's traditionally used, because traditionally he's not a socialist by the traditional use of the term, because he doesn't espouse centralized government control of business, of the healthcare system. He is for this strong social safety net and some other things that may touch on aspects of socialism, but it's different than economists have traditionally defined the word. So that's another problem. People using different definitions. You have to be very careful about what your operational definitions are when you're doing any kind of study. Okay, we're going to say this. We're going to use this word. It means this. We're looking at these very specific things, right? And it's difficult. It's hard. People don't want to do that. They want to take the lazy way out. That's why you hear Bernie Sanders, Denmark.
That's right. So, yeah, I think that's I've.
It is
I've
broken.
mentioned all
That's
I
the
have.
answer. Is
Okay,
the American healthcare system broken?
Sure, yeah,
yes,
broken.
It's broken.
All get out.
Right.
And my answer, of course, to unbreaking it, is to let individual freedom reign. And I have trust in others and myself to find the best outcomes that work for them on voluntary terms. So, unless you have anything else to add, Shane, I think we got a good chunk of information out there to the class. I hope folks are getting something to think about from these conversations. Check us out on Facebook and YouTube at Local Liberty, put it in quotes, and also localliberty.org is our website. Thanks for listening, and we'll see you guys soon.
Remember to subscribe to the channel.
That's right. Take care.